Hi, I'm Dr. Larry Malerba, and welcome to the ATH Clinical Case Series. Although today's case is rather simple and straightforward, it nicely illustrates the concepts of suppression and metastasis. It also demonstrates how homeopathy can easily treat a condition that by allopathic standards would normally require a course of antibiotics and an anti-inflammatory drug too. Jerry, a 62-year-old patient under my care for years, has just received a diagnosis of epididymitis. Jerry prefers to avoid medications and usually consults me for most of his problems. This time, however, he gave in to pressure from family members to allow himself to be vaccinated with both the flu and pneumonia shots. Shortly thereafter, he became ill with a cold that lingered for weeks. He had a sore throat, runny nose, and no energy. It dragged on for so long that he finally decided while on vacation to consult a conventional physician. Uncharacteristically, he wound up taking 2 courses of antibiotics, first zithromax and then augmentin. Although Jerry's symptoms eventually resolved, he then developed another problem. He started to experience pain in his left testicle. He returned to the doctor, who concluded that he now had epididymitis. Epididymitis is an inflammation of the epididymis, a tube that connects the testicle to the vas deferens, which is another tube that travels up into the pelvic region where it connects to the prostate gland. After being offered yet another prescription for antibiotics, Jerry finally decided that he'd had enough. He called my office, recounted the chain of events, and asked me if homeopathy could help his epididymitis. I asked him to describe his symptoms. 4 days prior to calling, he started to feel a pain in his left testicle. It was a severe pulsating pain that radiated from the testicle up into his abdomen on the same left side. The pain was focused mainly in the region between the testicle and abdomen. There was no swelling and no discoloration. That was pretty much it. He couldn't give me any more details. There were no other symptoms and no reported modalities. I looked up the following rubrics in the homeopathic repertory: pain in the left testicle, inflammation of the spermatic cord, and inflammation of the epididymis. This left me with a choice of 2 equally prominent remedies, pulsatilla and spongia. It would have been reasonable to prescribe either one of the 2, but then I thought a little more about how circumstances had unfolded. Jerry had gotten 2 vaccinations, after which he became sick for almost a month. When the upper respiratory symptoms finally receded after taking 2 courses of antibiotics, he immediately developed epididymitis. The chain of events was no coincidence. It could either be interpreted as an autoimmune reaction triggered by the vaccinations, or a case of suppression caused by the antibiotics, or possibly a combination of the 2. I went back to the repertory and looked up male genitalia metastasis. Pulsatilla is listed under this rubric, but spongia is not. The homeopathic literature references metastasis in cases of mumps, a condition that can sometimes spread to the testicles. When we think of metastasis in this way, as a condition that spreads from its primary focus to a seemingly unrelated, more distant location, then Jerry's epididymitis demonstrates this phenomenon quite nicely. I decided to prescribe pulsatilla. By the way, this reminds me of a dramatic case that I once treated many years ago. A poor fellow had cut his thumb almost completely off with an electric saw. It was sewn back on by a surgeon, and to my amazement, he complained of little pain. However, he consulted me because soon after the accident, he developed a severe, debilitating pain in his left testicle. It struck me that one of the main remedies for pain resulting from a laceration was also listed in the repertory under left testicle pain. I surmised that the shock of the accident was so great that his body attempted to displace the pain elsewhere. This was a case of pain that had metastasized. Repeated doses of Staph sagria brought rapid relief to his testicle pain. Anyway, I digress. Jerry was out of town and in pain, and I wanted him to take pulsatilla 30C, but he can only find pulsatilla 200C at a local store. I told him to take 1 dose only. He experienced great relief almost immediately. By the next day, the pain was nearly completely gone. He felt a couple twinges over the next few days, and then the problem vanished. And this occurred without Jerry taking any antibiotics or anti-inflammatories. So let's take a look at some of the lessons that we can learn from this case. First and foremost, the chain of events in Jerry's case was not a coincidence. They can be understood as an initial insult to the life force precipitated by the vaccinations, followed by a suppression of symptoms caused by the antibiotics, which then led to the metastasis of the problem to the testicle. These are exactly the types of connections that conventional medicine dismisses as merely coincidental, precisely because it has no holistic frame of reference by which to understand them. From a homeopathic perspective, they are important clues that led to a permanent resolution to a serious problem. Well, I hope you enjoyed this case. Please consider subscribing to the ATH YouTube channel, and that way you won't miss the next episode of All Things Homeopathy.